Welcome, everyone. You are in for a treat. You are the smartest people in Oakmont this morning in choosing to come to this Medicare Fundamentals program by HICAP. HICAP is health insurance counseling and advocacy program. It is a free program, and we're going to go by first names here. So let me introduce myself. My name's Tricia. When you have a last name like Schindeldecker, you understand why first name only is more than sufficient. I'm a member of the Oakmont Kiwanis, and it is our distinct pleasure to host HICAP in presenting this program on Medicare fundamentals. I'm going to turn the program over to Frank and Michael, and they are from HICAP, and they are going to give you the basics of what you need to know about Medicare. They came and talked to our Kiwanis club a few weeks ago, and we were all, our minds were blown. So many things that we didn't know. We thought we knew about Medicare. We thought we knew what Medicare was. And there's just so much more to know. And they provide the unbiased information about Medicare that we all need to know about so that we can make informed decisions that are financially and medically relevant to each of us.
Thank you so much for inviting us and that introduction. Michael, come join me. My name is Frank. I'm the Regional Program Manager for HICAP, the Medicare Health Insurance Counseling and Advocacy Program. It is a program that has been around since 1986 and is paid for by your tax dollars. So our program has been around for some time. And as I mentioned, I'm the program manager. And Michael, share with us your role in HICAP.
Good morning, everybody. So my responsibility is to put these events on so that the community, doesn't everybody hear me okay? Okay, is that better? All right, louder? Okay, sorry. So my responsibility is to present these, put on these presentations and hopefully get the attendance like we have here today. So my job mainly is to help the community. So that's what we're doing today. I hope you learned something today, and I hope you learn about HICAP and what we offer the community. Thank you.
So give me just one moment here. So as I mentioned, the HICAP program is publicly funded. Now we receive grant monies from the federal program, the Administration for Community Living. And many of you are familiar with this book. And in fact, many of you are now receiving the 2023 version. And if you need to reach HICAP, guess whose number is on the back? Yes. Now, an interesting side note is it's an 800 number. Our program is statewide. It's also a nationwide program called the SHIP program. And of course, California renames everything. Medicaid in California is called Medi-Cal. The SHIP program in California is called HICAP. In Oregon, it's called SHIBA. In Florida, it's called SHINE. But we all do the same two things. And we're going to talk about those. But the funding comes from the Administration for Community Living down to the Department of Aging. And the California Department of Aging then sends additional state funds to the different HICAPs throughout the state, because the state is broken into regions. And our region is the North Bay region, serving 6 counties of Marin, Sonoma, Mendocino, Lake, Solano, and Napa. Now, as we go through today, you may have a knowledge of your Medicare, but Medicare is as easy to understand as taxes. Oh, wait, taxes aren't easy to understand. Although if you're a tax preparer, and I know in this community, there are several, and in fact, we do have a tax preparer in the audience, but I know that you do taxes here for individuals and are able to assist them with those complexities. And a number of our counselors are also tax preparers, because learning Medicare and all of the intricacies is not for the faint of heart. So as you understand your Medicare, I can assure you there is a whole lot more to it. And today we are going to do a review of some of those things, but I know that you will also learn some things. Because when it comes to Medicare, there's a very important concept to understand, and it's this. The answer to every Medicare question is, it depends. The answer to every Medicare question is, it depends. Because for one scenario, there are many different answers, many different options, depending on your situation. So we are going to do a review, but also delve into the details. But before I go into any more detail, I wanted to talk about the two things that HICAP does. One is what we're doing today. Educational seminars on various topics. And if you go to our website, senioradvocacyservices.org, and click on the calendar, you'll be able to see the different seminars that are happening in the surrounding area. Maybe we're doing one here. We also sometimes have some Zoom seminars on various topics that you can register to attend. So educational seminars is one thing we do. The second thing we do is individual one-on-one counseling. In this day and age, how often do you get one-on-one help with anything anymore? And especially something such as Medicare, where you may have an individual situation and really need to sit down with someone. Because as you have called 1-800-Medicare, I'm sure you have gotten right through with no waiting time, correct? I see a few people that didn't have that experience, and that's the challenge that most people face. So being able to sit face to face with someone is a huge benefit. Now, with us today, we are fortunate to have one of our HICAP counselors who went through an extensive training and learned a 3-inch manual, went through several months of internship, to then become registered with the California Department of Aging as a registered HICAP counselor. And Tom, come on up. Tom has been a counselor for some time, and this year he is stepping into and considering the role of being an educator with HICAP. Tom, good morning.
Good morning.
What I wanted to do was put a face with a name, because we are going to be talking with the management here about having HICAP, once again, as we did in the past, have some space in one of these rooms a few times a month to be able to set appointments so people in the community will be able to sit with Tom and one of our other counselors, depending on the schedules they have, to get that individual one-on-one help. Tom, how long have you been a counselor with HICAP?
About 4 years with 3 different HICAPs.
So you probably have a few stories of some of the challenges that you have faced as people have come with you, correct?
That's very correct.
There is just so much to understand, and we are glad to have Tom with us at HICAP. And as a member of your community, I know you will benefit, as will others, when you need the help. Thank you, Tom.
You got it.
So let's discuss and go through very briefly some of the qualifications for a person to become eligible for Medicare. As many of you experienced, when you turned 65, you became eligible. Also, if someone has been receiving disability for 2 years, starting the month after, month 25, they also become eligible for Medicare as their health care. If a person has end-stage renal disease, they qualify. And there are a couple diseases that if a person has, automatically qualifies them to have their health care as Medicare. Now, when we look at Medicare, we're going to go into each of these parts, but understand that when a person enrolls in their Part A, their inpatient coverage, and their Part B, their outpatient coverage, then they have a decision to make. And the decision is, which way do you want your Medicare? Do you want it, as you see there on the left-hand side, as original Medicare? Because there are some advantages and disadvantages to having your Medicare that way. And if you choose to have it that way, you would add on 2 additional parts to your A and B. You would add a separate drug plan, and you would add a supplemental product called an Advantage plan. The other way you can instead choose to have your Medicare is through what's called an Advantage plan, a managed care plan that you assign your Medicare to, your A and B. Medicare pays them a flat rate for you every month. And then if and when you have a medical situation, Medicare says, don't talk to us. You joined them. We paid them. They're in charge of your Medicare. So also there are some advantages and disadvantages of choosing to have your Medicare that way through an Advantage plan. Well, let's delve into some of the situations in which a person finds themselves becoming eligible for Medicare. Now, if a person is already drawing Social Security, they're already in the system. So they automatically receive their Medicare card with their A and B. And once again, they then have a choice to make, which way do I want my Medicare? If a person is turning 65, realize there is a 7-month window for them to enroll. 3 months before the month of their birthday, the month of their birthday, and 3 months after. Now, there's an interesting technicality that I will share with you. For a person whose birthday is on the 1st of the month, they are actually eligible to enroll in Medicare the month prior to that. And as a person enrolls in Medicare, either 3 months before, 2 months before, 1 month before the month of their birthday, the benefits begin on the month of their birthday. If they enroll on the month of their birthday, it begins the month after. If they enroll the month after, it begins 2 months after. If they enroll 2 months after, it begins 3 months after, is the way it used to be until just recently. We're going to be talking briefly about the Inflation Reduction Act that was signed into being. And within that were some elements that directly impacted Medicare. And one of those is doing away with that waiting period when a person enrolls. So if they enroll the month after their birthday, their benefits will begin that next month, rather than having to wait and have it pile up and those benefits then begin. Now, if a person is not drawing Social Security, then they have to do something to enroll in Medicare. And there are several ways to enroll. And again, when I say Medicare, I'm referencing specifically Part A and B, because that is your Medicare. So if you need to enroll in Medicare, you can enroll over the phone, 1-800-Medicare. You can enroll through the website, medicare.gov, or you can go to the Social Security office. Now, just a brief note about the role that Social Security plays in relation to Medicare. Social Security deals with the retirement part of it. They are the experts in that. But if you wanted to meet with Medicare right now, where would you have to go to meet eyeball to eyeball with Medicare? Well, a high rise in DC full of cubicles. So Medicare does not have local offices. They subcontract with the local Social Security offices to be the place that you can turn in Medicare forms. They can give you Medicare forms. They can look at the Medicare computer, but they are not Medicare. And that's why 9 times out of 10, when you go in the Social Security office and start asking questions, they will say, oh, go talk to HICAP. They'll answer your questions. They'll help you understand all these pieces, and then come back and we can hand you the form and you'll better understand what we're trying to say. So it's important to understand the role of Social Security, as they are not technical experts in Medicare. They know what they need to know, but their specialty is elsewhere. And that's some of the role that HICAP plays in being able to provide that technical expertise, because that's all HICAP does. And believe me, Tom will nod his head saying that's probably enough. People often ask, is there an organization like yours to help with Medi-Cal, state financial assistance? And the answer is no, there isn't. Well, HICAP, will you help us with Medi-Cal? No, our specialty is Medicare. We will assist with Medi-Cal pieces, but only as they directly correlate to Medicare. Because believe me, that's enough. So let's delve into Part A, the inpatient part of your Medicare. Now, when you have a medical situation, there is a subsequent bill. And that bill is parsed out to different parts of your Medicare. And when you're admitted, because this is the inpatient portion, when the doctor writes the order and you are admitted into the hospital, into skilled nursing for rehab, into hospice end of life, or you need some transfusions, portions of that bill are sent to the inpatient part of your Medicare. Now, for most people, through the years, you notice deductions from your paychecks to Medicare. And when a person becomes eligible for Medicare, if they have enough contributions, then this part of the Medicare has no monthly premium. And that's most people. Now, if a person does not have enough contributions, then they may have to pay a premium for this part of their Medicare. Now, just a brief aside, as we think about the different parts of Medicare, think of them as different boxes with their own premiums, deductibles, copays, their own timelines. Each are their own separate components. And Part A is no different. We notice that this year, it has a deductible of $1,556. Now, of course, a deductible is what you pay before insurance starts to pay. So as you're admitted into the hospital, the first $1,556 of those charges you will be receiving as your portion of that inpatient stay. Now, some of you are very astute and you have been watching what has been released recently in terms of what's coming out for 2023. And what we know is that the Part A deductible for next year will be $1,600, $1,600. Now, just an aside, that deductible is not per year. That deductible is per benefit period. So without going into detail, you could have that deductible several times in a bad medical year. Now, you notice there are daily copays after certain timeframes. So when you are inpatient for 60 days, then starting day 61, you have a daily copay. Now, remember, you're probably thinking, well, who's in the hospital for 60 days? An important word to remember is cumulative. You may be in the hospital for 4 days, later on plus 12 days, later on plus 5 days, later on plus 28 days. And suddenly you see cumulatively, you're getting close to that 60-day mark. And there are all sorts of technicalities within there as a person finds themselves in that situation as to how that's counted, how it's calculated, the nuances of that, that again, we're able to help you understand. Skilled nursing. When it comes to rehab and skilled nursing, Medicare covers up to 100 days. I mean, like any insurance, there is a limit to what they cover. And in Medicare, the limit to what they cover in skilled nursing is 100 days. Now, the first 20 days, because you just came out of the hospital, you typically need a lot of care, so there is no copay that first 20 days. But starting day 21, you notice there is a daily copay. And these numbers, once again, are changing for 2023. Because remember, I mentioned a very important thing, that the answer to every Medicare question is, it depends. Here's another important thing. Every year, everything changes. Every year, everything changes when it comes to plans and costs and charges and details. And you'll see some of those changes and some of those things that I want you to be aware of, and we'll talk a bit more about. Part A was your inpatient coverage. Part B is your outpatient coverage. And when we look at a medical bill, the outpatient charges are the majority of that bill. The ambulance, the doctors that see you, the surgeons that treat you, the medical equipment, the walkers, the wheelchairs, the slings, the rehab after surgery or a situation, diagnostic tests, lab services, all of those charges, the majority of a medical bill is parsed out to this part of your Medicare, Part B. Now you notice the premium, and it may be a familiar number to most of you, as you see that Part B monthly premium deducted from your Social Security check. Now, once again, if you're staying on top of it, you are aware that next year, Part B premiums are coming down to $164.90 per month. And you may be thinking, well, Merry Christmas. But why? Well, the interesting answer is that there was a particular medication that was coming onto the market related to Alzheimer's that was going to be exceedingly expensive. $60,000 a year if the doctor prescribed it to you. And Medicare was worried about that coming on and their responsibility to pay portions of that. So they had increased the Part B premium in anticipation of that rollout. Needless to say, there was a lot of pushback. The manufacturer drastically dropped their price. And subsequently, Medicare was faced with a situation of, well, we don't need to sandbag as much money in anticipation, so therefore we are going to reduce Part B premiums for this next year, thanks to this medication and it not being as expensive. All of you benefit. Now, Part B, once again, has its own deductible, and next year, the Part B annual premium will also decrease to $226. But notice, what percentage of a Part B expense are you responsible for? 20% of that $4,000 ambulance ride, 20% of that surgeon that did the surgery, 20% of the doctors and the rehab and the wheelchair and the sling and different services. The majority of that bill, 20%, is your responsibility for that $170,000 heart attack. Sadly, The second reason for bankruptcy in this country is typically healthcare. Because most people cannot just write a check for 20% of a $170,000 heart attack. So Part A, your inpatient coverage. Part B, your outpatient coverage. And just because you turn 65 doesn't mean you stop working. For many people, they continue working and they have health coverage through their employer. And enrolling in Medicare would just be redundant, would be additional expense, additional coverage that if they have good coverage through their employer group health plan is sufficient, and they can defer enrolling in Medicare under certain circumstances. Again, if a person is self-employed, there are some nuances in there. So if you know someone or you find yourself coming into Medicare and will be still working and through work are enrolled in an employee group health plan, you may have some options in terms of considering setting aside your Medicare until you're no longer actively working. And that's a very key term, actively working. Because some people have been granted benefits on their retirement saying, you're retiring as part of the package, we will pay your benefits for 2 years. And then people come in, they go to our website to set an appointment, or they call HICAP to set an appointment, and they sit with a counselor like Tom, and Tom says, welcome, did you find a place to park? Okay, I see your information is this and your address is that. So congratulations on retiring. You just stopped working? Oh no, we haven't been working for 2 years. Uh-oh. Because there are certain timeframes and certain details. And in this instance, a clock starts ticking. Once a person stops actively working, they have some timeframes to enroll in Medicare. And if they miss those timeframes, now they're accruing penalties. And sadly, those penalties related to drug plans and Part B stay with you the rest of your life. Now, just a brief aside about preventative services. You know, when the Affordable Care Act came into being, Obamacare, the challenge was looking at healthcare in this country, and particularly Medicare. You can imagine what it costs the federal government for Medicare. Looking at ways to reduce cost while maintaining benefits. And the answer they came up with was prevention. And if you look in your Medicare and U book, you will notice on some of the pages under the preventative section, there are icons that are little blue apples. All of those things are preventative services that if your doctor orders it during a specific visit is covered. And that list used to be very short, but as a result of the Affordable Care Act was significantly expanded. Now, here's the important part to remember. Medicare does not cover physicals. I mean, what would you think, how would you define what a physical would be? Well, you go in to see the doctor, they take your blood pressure, maybe the doctor orders a routine blood panel just to kind of get a baseline. Maybe the doctor says, oh, osteoporosis runs in your family. Let's order some x-rays or just kind of get a baseline as you're coming into age 65 so we can know where we're at. And some other things. So that's what we would assume is a physical. Medicare does not cover physicals. It covers a very unique visit. I often laugh at the term that when you turn 65, you can go in and get a welcome to Medicare visit. And every year thereafter, you can have a wellness exam. that is not a physical, that visit is a very specific visit. And it's essentially a questionnaire. How's your vision? How's your diet? How's your balance? How's your sleep? How's your stress? How's your this? How's your that? Because some of you are like myself, that I'm not going to go into the doctor unless I'm dragging a leg or I'm in bad shape. And that's the point of them coming up with these preventative services in an effort to have people go in, at least have this questionnaire, have a chat with the doctor. And then as the doctor identifies some issues, hopefully those issues are identified sooner than when they're a stage 4 something and the most expensive treatment. Now, if your doctor in the conversation, well, let me ask you this. Are doctors experts in medical billing? Yes or no? The audience said no, you're correct. He pays someone who's the expert in medical billing. So when you ask your doctor, oh, is this covered by Medicare? Typically, they're going to say, well, yes, it is. Well, technically, that's correct. That visit is, but maybe some of the things he's ordering, that lab work, that x-ray, those other things are not covered. And subsequently, we have people who set appointments with HICAP coming in going, I'm getting these bills and these so forth. I don't understand what this is about. And I would like to sit with someone who can explain it, who can look at it, and who can give me an idea of what's going on, because Medicare should be covering the lab work and covering the x-rays. Why aren't they? Oh, you were in a wellness exam and the doctor ordered these. The only thing the doctor can bill Medicare for is that visit. If anything else is added onto that billing code, guess who gets the bill? Now, if you set a subsequent appointment and the doctor does these other things, it's not part of that wellness exam or that welcome to Medicare. Therefore, it would be covered. Some of the nuances. So one thing that we recommend is when you go into your doctor's appointment and you've turned 65 and you've called a few weeks ahead and said, I'd like to schedule a Medicare, welcome to Medicare visit. When you go into the office to sign in like you do, ask the smiling face across the desk, oh, by the way, what do you have down there for me as my visit today? Oh, we have it as your Medicare physical. Let me ask you this. When the doctor pulls that clipboard off the door and looks at it and sees physical, what direction is that doctor going to go? In the direction of a physical. And 9 times out of 10, who's going to get the bill for all those physical related types of things that Medicare doesn't cover? So that's your opportunity to go, oh, no, it's a wellness exam and that's not a physical. So, they can clarify it. And the doctor, who's moving fast, has an understanding of really what your needs are and what the expectation is. Here is a list of those preventative services. And once again, many of you use this as a doorstop. You use it as to kill spiders. Who knows what you use it for, or you simply circular file it. It's actually a good resource. So with each of these preventative services, it goes into detail as to what the criteria are. Under what conditions could the doctor order it? How many of this could they order? The frequency of what they can order. Oh, and a subsequent use for this book, if you're an insomniac, it's great reading. It'll put you right out. So hang on to this book. It's really a valuable book, as I'll show you even more. Now, remember I said the answer to every Medicare question is, it depends. And we know that the Part B outpatient premium for next year is going to be $164.90. That's the premium for most people. But it depends, because if you're low income, be aware that there is assistance if a person qualifies financially and related to assets. So if some of these, somebody, or some of these numbers apply, you may look into receiving assistance with Part B, the outpatient part of your healthcare. Conversely, if a person is higher income, they may have to pay more for their Part B outpatient coverage. And that's called an IRMA, an income-related monthly adjustment amount that is added to your Part B premium, depending on a certain line on your tax return. The modified adjusted gross income. So whatever number is on that line determines whether you have an IRMA. And there's an IRMA for Part B, the outpatient part. There's an IRMA for Part D, the drug part. So if your premiums are higher, you more than likely have an IRMA, an income-related monthly adjustment amount that is added to your premiums. Now know that they have just published these numbers for 2023. So if you're interested, you can either set an appointment with HICAP, or you can go online and Google income-related monthly adjustment amount 2023, and you will have those numbers there as you consider what your expenses will be. Now know that they do a 2-year look back. So whatever your modified adjusted gross income is from your tax return 2 years ago, that's the number that will be used to determine whether you have an IRMA as an individual or if you're filing jointly. And I see our tax preparer nodding her head. Yes, you've seen a number of those, I'm sure. Okay. So we are talking about original Medicare. We have talked about Part A, your inpatient coverage. We have talked about Part B, your outpatient coverage. And if you choose to have your Medicare through original Medicare, then you have to add on 2 other parts. And one of those parts is a product sold by insurance agents, like life insurance, car insurance, home insurance, Medigap insurance. It is a product that supplements what you have to pay out of pocket related to Parts A and B. Remember, we talked about those things that you had to pay out of pocket, those deductibles, co-insurance, and copays. That Part A deductible, those Part A daily copays after certain timeframes, that 20% that you have to pay of those Part B charges, the copays related to, or the deductibles related to Part B. You can buy a product that covers those deductibles, co-insurance, and copays. Now, here's something to be aware of. Don't confuse Medicare Part A, your inpatient coverage, with Medigap Plan A, one of the 10 Medigap plans. I wish they would have named them shapes or colors or animals, but no, they named them letters of the alphabet. So years ago, the insurance industry said, hey, people are paying a lot of money out of pocket. Let's come up with a product that if and when they have those deductibles, co-insurance, and copays, they can purchase a policy that will cover those. There are 29 companies that sell 10 Medigap plans. 2 of those Medigap plans actually have 3 separate options. There's a standard Plan G, Plan F. There's a high deductible Plan F and Plan G. And 3 of those companies wanted to stand out from the crowd, so they were able to get creative and get an innovative G pushed through, but know that those are a bit different. And the important part is read the fine print, because not all of these innovatives are the same. There's no standardization. The standardization is the plan. Now, down the left-hand side, what you're looking at are the deductibles, coinsurance, and copays related to parts A and B. Along the top, you see the letters of the alphabet, the different Medigap plans. And if you look down the column, you notice that Plan A covers 4 of those deductibles, coinsurance, and copays. And when you look at Plan F as in Frank is the most comprehensive plan. Now, some of you may say, well, Plan F is no longer available. As of January 1st of 2020, Plan F was no longer available. Careful. It is still available. Here's the question. When did you turn 65? Was it before January 1st of 2020? And maybe you've been working and you deferred enrolling in Medicare and now you're enrolling in Medicare and you decide you want Plan F? If your birthday of turning age 65 was before January 1st, you can still purchase F. Now, for everybody whose 65th birthday was after January 1st, well, the only Medigap, the most comprehensive Medigap they can purchase is Plan G. And notice the one thing that Plan G does not cover is that Part B deductible, which we learned this next year is $226. Now, of all the Medicare pieces, in my opinion, this Medigap piece is one of the most complex pieces. It's a product that insurance companies came up with. Agents are contracted with the company to sell their company's Medigap. Even though the plan may be standardized and a Plan M is a Plan M is a Plan M, no matter who you buy it from, the difference is price. As much as $100 a month difference in price for the exact same product. So I have spoken at large presentations. I have been with representatives who have had town halls, and people say, the cost of Medicare should be reduced. Okay. When's the last time you checked your coverage? When's the last time you looked at how much you're paying for your Medigap plan? If the difference is price, why would you pay $100 more a month for the exact same thing? Have you checked? Most people haven't. So here's something I would like to challenge you with. Make this the year that you look at your Medicare. Make this the year that you look at your Medicare, that you evaluate your Medigap plan. Now, there's a time frame to do that, and the time frame is your birthday. When's your birthday? Your birthday plus 60 days. That's your window of time to review this piece of your Medicare. Because as we get into the complexities of it, whether you choose a standard plan or you consider a lower premium but pay a higher deductible for a high deductible Medigap plan, or you consider an innovative product of which the companies don't even name them the same, there is a lot to consider. So put it on your calendar. Your birthday plus 60 days is your window of time to review. Now, once again, as HICAP, you can set an appointment with a counselor to understand some of the nuances. And as HICAP, we have exclusive access nationwide to do price searches of these Medigap companies. Because think about it. If he and I are insurance agents and his Plan G is $112 a month and my Plan G is $215 a month, who's going to buy that if I advertise it? So they don't. And agents are contracted with the company. So if you went to your State Farm agent and you were looking at car insurance and you said, hey, agent, how much does Geico charge for this same coverage? He'd go, I don't know, go to Geico. Well, how about Allstate? Well, I don't know. I'm with State Farm. You'd have to go to Allstate. That's the insurance industry and how it's set up. Remember, there's 29 companies. Maybe a broker is contracted with 5 companies to receive compensation if he sells this product and enrolls you. And that's a service we provide because HICAP is truly unbiased in that you can go to our website. There are 5 green buttons. And one of those buttons is a Medigap plan search. You enter some information, and then we do a search through this database we have exclusive access to. And we send you back the 3 least expensive companies for the plan that you're choosing. So on your birthday plus 60 days, you can then sit down with the report and go, interesting. If I choose this one, I'll be paying $63 less a month. Let's see, 63 times 12. Yeah, that's worth it. Here again, that's a service we are glad to provide. We will actually get to questions at the end. Yes, so save it. I'm going to move along here and let's talk about drug plans, Part D. So original Medicare, Part A inpatient, B outpatient. You purchase a 4th piece called a Medigap product that covers what you pay out of pocket. And the last piece of original Medicare is prescription coverage. Now notice, every year, really nothing changes. Wait, is that what it says? Every year, everything changes. Companies come and companies go. Next year, there are actually going to be 26 Part D drug plans to choose from. They have different premiums, and in fact, the lowest premium will be $4.50, and the highest of the 26 companies will have a premium of $170. Different deductibles. The Part D deductible, oh, I don't have it down here. I believe it's $505, if memory serves me correctly. I may be off on that, but it's over $500 is now going to be the highest. And the majority of drug plans have a deductible because, of course, what they do is they balance, we'll have a lower premium, but we'll include that deductible. Lower deductible, higher premium. So they play that juxtaposition in that balance. Formularies change. How many pills are there out in the world? Too many. There's a lot. Not every plan covers every pill. They have different formularies. Copays, what you pay at the window. Here's the situation. A person will say, well, how do I choose a drug plan? The plan you choose depends on what prescriptions you're on. So you may have the plan that you're on may be the best plan for you, and it may be the worst plan for me. Why? Because we're on different prescriptions. So every year, everything changes. And once again, make this the year that you search drug plans if you have your Medicare as original Medicare. You can do it yourself on medicare.gov. Or once again, that's a service HICAP provides. You go to our website, 5 green buttons. One of them is a worksheet. You type in your medications, the dosages, several pharmacies, hit submit. And we do the heavy lifting of then searching all of the plans and send you back the 3 least expensive plans specific to your medications. So you can once again sit down, evaluate, and go, wow, if I switch plans, it'll cost me less and it'll cover all my medications because it seems next year the plan I'm on is dropping 3 of my medications. And we get those frantic calls in the new year. I'm standing in my pharmacy and they say 3 of my 10 medications are no longer covered and I don't have $180 to fill that prescription. Oh, what do I do? Well, did you do a search? No, I was happy with my plan, so I just let it roll over. Well, sadly, you're stuck for the next year because every year you can evaluate what's changing next year. And the time frame for this piece is October 15 through December 7. And dare say, when we look at September 29 as HICAP, we are definitely gearing up because do hundreds of searches for people who want to know what's changing and whether they need to make a change, because December 7 is the cutoff. And whatever you decide is what you have for next year. So make this the year that you look into, is your drug plan still the least expensive and provides the coverage for your prescriptions? And there you see it. October 15 through December 7 is that time every year. If you're deferring your Part B because you're in an employee group health plan, realize there's certain timeframes for the drug part of that deferring once you start to enroll. And there are other enrollment periods that, again, depending on your situation, determines what is relevant to your situation. Now, if you are a veteran, you may or may not be familiar with TRICARE. And the fact that TRICARE for Life is specifically related to veterans who are retired and provides additional coverage that they do not have to pay for. So if you fall into that category, I highly encourage you to go onto the website tricare.mil, M-I-L, military, tricare.mil, and look into those benefits. So often our counselors sit with people who are veterans and we ask the question, are you a veteran? Yes. Oh, are you familiar with TRICARE for Life? No, I don't qualify for anything, or no, I haven't looked into it. You may be surprised what you qualify for, and you wouldn't need to buy a separate Part D drug plan because that's part of it. You wouldn't have to buy a Medigap because that's part of TRICARE for Life at no cost to you because of your service. Look into it. It's definitely important. And there you have it, tricare.mil, 844-866-9378. TRICARE for Life is a Medicare wraparound for retired service members and their families who have Parts A and B in addition to the VA. And once again, we are glad to have you set an appointment to sit with a counselor to better understand your situation, whether it be your retiree plan through CalPERS or CalSTRS, whether it's in relation to getting your coverage through the VA and how does Medicare interface with that, or do you even need it? Those are the kinds of things that we are able to assist people with as a truly unbiased source, since we don't sell anything. People say, how do you reduce costs? Well, search your drug plan. That's a big one, because not only which plan you choose, but which pharmacy you go pick it up at has a huge bearing on how much you'll end up paying at the window. So if you and I are on the same drug plan and we in fact take the same pill, but you go pick it up at one pharmacy and I go pick it up at another pharmacy, at the end of the year, we could be hundreds of dollars apart in how much we ended up paying. And once again, if a person is low income, they may qualify to receive assistance with Part D, the drug part, depending on their income. Conversely, if they are higher income, they may be assessed an IRMA, an income-related monthly adjustment amount, onto whichever premium of their Part D they choose because of that 2-year look back and that specific line on their tax return. So as I mentioned, you can go to medicare.gov, do your own search, or that's a service HICAP provides. Go to our website, click the button, fill out the medications, dosages, and pharmacies, hit submit, and we are happy to then do the heavy lifting and send you back the 3 least expensive plans specific to your medications. So let's talk briefly about Advantage plans. We talked about one way to have your Medicare there on the left, original Medicare. And many people choose that because you can go anywhere in the country to any provider who accepts Medicare and get treatment. So if the world-renowned specialist is in San Diego, go to San Diego. If you're visiting a loved one, a daughter, a friend in Chicago, and because it's icy there and probably don't have the shoes that you're used to, and slipped and fell and broke something, you would prefer to stay there to convalesce after the surgery. Stay there and convalesce. Medicare, original Medicare does cost a bit more monthly when we add up Part A, nothing. Part B, $170.10 this year. A drug plan for about $34 a month on average. A Medigap for a Plan G, about $140 a month. Around $340 some dollars is what you would pay per month to have your Medicare that way as original Medicare. But when you had a medical situation, you wouldn't see any additional bills. And there's no copays because your Medigap picks it up. There's no pre-approval, no pre-authorization, no networks that you're limited to, but it is more expensive. The other way to have your Medicare is less expensive monthly. You still have to pay your Part B monthly premium, but you don't have to pay a separate drug plan because that's part of the package. You don't have to pay for a Medigap because it's not even part of Advantage plans. So monthly, your cost is less. But remember I said that word monthly? Having your Medicare this way means that you have copays everywhere you go. If you go see a doctor, you have a copay. You go see a specialist. You go into urgent care. You go into the clinic. You have an ambulance. You go into therapy. Copay here, copay there. Everywhere a copay. Up to a certain limit, of course. But when we look at some of those limits, for instance, in Sonoma County, we look at a company like Western Health. Their maximum out of pocket is $7,000. So through the year, as you pay copays and it finally hits $7,000, then no more copays the rest of the year. And understand, agents also are compensated when they enroll you in the Advantage plan they represent. And if you look on the CMS website, Centers for Medicare and Medicaid Services, you see, you can look at the commissions that an agent receives when they enroll you. And it's about $775 per person. And if you multiply that times the number of people in this room at a seminar that is put on, you can see why coming October 15, there will be a lot of seminars everywhere you look. And of course, they may talk generically about Medicare, but the fact is, they will have your address and your email to be able to then follow up. And understanding this product, the Advantage plan, is important because for some people, this is a good choice. It provides additional benefits: vision, dental, hearing, a gym membership, perhaps pet care, perhaps meals after a surgery, perhaps grab bars, perhaps air purifiers. Join our plan, says the Advantage plans. Now realize the plans that are available to you depend on where you live. So this year in Sonoma County, there are 17 Advantage plans to choose from. And each of them has different networks of doctors. So if you switch to a different Advantage plan, you have to switch doctors or switch hospitals because different hospitals are contracted with different Advantage plans. So once again, make this the year that you take a look at how you have your Medicare, and the October 15 through December 7 is your opportunity to switch from one Advantage plan to a different Advantage plan, from Advantage back to original, or from original Medicare into an Advantage plan. Now, there are some nuances. Once again, if you switch from an Advantage plan back into original Medicare, please talk with us first because you could run into some potential issues of not having access to one of those parts of original Medicare. And so often people watch television and listen to the ads. Should you ever listen to ads? Yes or no? No, I hear a resounding no. And that would be correct. I can't tell you the number of calls we get in our office for appointments saying, I don't understand. My doctor and I have been ramping up for this surgery and preparation and things I had to do and procedures I had to, and I had it set for a month from now. And I listened to this commercial. I switched into a different plan and they're telling me my doctor and all of this is no longer covered. So now I need to start all over again. Nobody told me that I needed to ask my doctor whether they're covered under this Advantage plan. It was a great commercial. Seniors running through fields of daisies and all these things they were promising. Of course, they talk real fast, and a lot of the things, Aetna, Blue Shield, Western Health Advantage, Scan, all these companies, many times in the commercials will talk about the benefits. And when you call, oh, well, it doesn't apply to where you live. It applies to those beneficiaries in Los Angeles where we have plans. So beware, because whose responsibility is your healthcare? You think your doctor's going to take you by the hand? You think a plan is going to say, oh, next year for your pocketbook and your health, we're no longer the best plan for you. Why don't you go to our competitors? So getting educated is the right thing to do, as you're doing today. And you can see that in the different counties, Napa this year has 14 Advantage plans. Solano has 14. And if you're a retiree, be very careful of enrolling in a separate Advantage plan or enrolling in a separate Part D drug plan, because without understanding, you may forfeit all of your retiree benefits. And once that door is closed, the door is closed. Well, I didn't know. Well, that's why HICAP is here, to truly be that unbiased source that can walk you through, answer your questions, and help you understand the best pathway for you in relation to your healthcare. So be aware of these dates, October 15 through December 7. If you have original Medicare, have a drug plan search done. If you're considering an Advantage plan or want to look at all the different Advantage plans and see what might be best for you, set an appointment. We're glad to help. And if January 1st, you have your Medicare through an Advantage plan, you have an additional period of time through March 31st to make changes from one Advantage to a different, or from Advantage back to original. That was legislation that came into being a couple years ago, with this additional period of time to make changes if January 1st your Medicare is through an Advantage plan. Now, Tom is a volunteer with HICAP, and 10,000 people a day are becoming eligible for Medicare. So if you're the kind of person who thinks learning a 3-inch manual and going through an internship would be interesting and engaging and something you can sink your teeth into and keeps you dialed into some things, then we would be glad to talk with you and have you join Tom and all of the other counselors that we have spread throughout the 6 counties. And you can go to our website and go to the HICAP page and take a look at some of the details and get a better idea of what that all means. So with that, I will take questions for a few minutes here. I know that we are running over, but I would be glad to take those questions. And the formal part of our seminar has concluded. I know that this is being recorded, but this portion now going forward, I don't know that it needs to be part of the recording. So that would probably save some time, but thank you for inviting me, and make this the year that you look into your healthcare. And if HICAP can truly be of assistance as a truly unbiased source, we are glad to do that and glad to help you. Thank you. Okay, questions?
The Kiwanis Club thanks you very much for coming. And if you are interested in what more of the Kiwanis does for the community, we have our meetings right here on Thursday mornings with breakfast at 8 o'clock. We have coffee and cookies over here for your enjoyment. Help yourself. And thank you for coming and looking forward to these questions. Boy, did I learn a lot.
It's a complicated topic, and this is a great group. They invited Michael and I to one of their meetings to kind of ask, so who is HICAP and what? And we just had a great time. So great group. I definitely encourage you to get involved, make a difference with them. Okay, question. Sure. So the question was, where is the recording available? And the answer is, it will be on the community channel. All right. Who else? Another question? Yes. Sure. Now, remember I said the answer to every Medicare question is it depends. So if a person has Medi-Cal, state financial assistance, then their situation depends on some other things as it relates to Medicare. And what she's sharing is sometimes a person has gone over the limit of what they qualify for Medi-Cal. So now they must share in the cost. And in those instances, we are again glad to provide a search, but more importantly, identifying, well, how much are they over? And then simply looking at the drug plans and going, that one's $10 and they need 12, that one's 15, that's the one. So it doesn't have to be complicated. We're glad to help, but I don't know that what we do would be much help, because it's literally that. And we explain that share of cost many times, because Medi-Cal says, call HICAP. They don't explain share of cost. They send them to us, and then we send them back for things. It's the system we have. So thank you for your help. Yes, question.
How many years you've already been on Medicare program?
The only
Medicare
time,
Advantage?
no, the only time, the amount of time you have been on, well, let me think about it. No, the amount of time that you have been on Medicare doesn't apply to anything.
So if you picked a plan, let's say when you were 55 or 56, and 20 years later, I'm sitting here and it's a whole different ball game.
You're probably paying hundreds of dollars too much a year. I would almost guarantee that. I would put money down that you're paying hundreds of dollars more than you need to.
Okay, thank
Because
you.
every year, everything changes. For instance, in the drug searches, and remember I mentioned that agents get compensated when they enroll a person in the drug plan that they get compensation from. If the premiums this year are $7.50 up to $160, that's a pretty big range of 25 plans. And we did a search for someone who was paying $130 a month premium. And my first comment was, I bet you didn't do the search yourself. She said, no. I said, how did you get it done? I'm guessing you went to an agent. How did you know? Let's see, which plans do you think pays the highest commission? So we did a search for her. The best plan for her and covered her medications was the $13 a month plan. She was happy and angry at the same time. Happy that she found least expensive plan in HICAP, angry that she had been lighting $1,000 a year on fire simply by not checking the drug plan each year, when she could have been paying $13 a month, not $130 a month in a premium. Whose responsibility is your healthcare? We're glad to do that. And Tom, I'm sure, can share many situations of people who have not bothered to check because of the complexity of all of this and kind of stuck their head in the sand, and suddenly we're running into problems, or suddenly realized, oh my word, you mean I didn't have to pay this much? I could, yes. So make this the year and get educated, because it is your healthcare and we are glad to help. So this is your year. All right, whom else? Yes.
On the two numbers up there, the 800 and the looks like a local number.
Yes.
So is that a local office here?
Yes, interesting on that. So the state is broken into regions. Our administrative office is in Petaluma, but our counselors, we don't have other offices. Tom would have a site on certain days by appointment in one of these rooms. He'd come in, first person, second person, third person, he would leave. So when you call this 800 number, it looks at the area code and prefix of the phone that you're using, which of course, the other month I had great fun with somebody, because as she called, and the more I talked with her, she was naming places and things. I said, I was thinking, she's not from around here. I said, well, I'm guessing that you used to live in Sonoma County. She said, how did you know? And I said, look up in the corner of your room, smile and wave. She's like, what? I said, no, just kidding. It looks at the area code and prefix of the phone that you're using and routes you to the nearest HICAP. So if you bring your San Diego phone and you call 1-800, it's going to connect you with the San Diego HICAP. So if you have a local number, it'll connect you with us, or you can call us directly. It all goes to the same place. Yes, question.
When do you anticipate getting a room in here to see clients?
Well, I'm going to be meeting with the, what is her title? The general manager after this, in an effort to get Tom a space to be able to help all of you on a consistent basis. So we don't know, but we are working on it. Uh-oh.
Actually,
He's going to do stump the chump.
no, mine's very easy. I have to leave for an appointment. Can I get a photo with you and Tom before I leave?
Oh, a photo opportunity.
Yes.
All right, let's see if there's any more questions. And if there are, or if there isn't, thank you so much for having us. And if there are questions, like Tom, did you have a question or are you commenting?
Just a comment.
Yes.
That we still do phone counseling.
Yes,
So don't
thank
feel like
you.
there's no counseling because we don't have a room here yet. But we can get on, we've been doing it all through COVID. So there's a.
Yeah, currently when you set an appointment, the counseling is via phone, and we are just starting to roll back into in-person. So you can still get the help. Thank you so much. We welcome your chance to help you. Thank you.